Upload. Edgar has been feeling down lately. Even though Edgar was a good student, he failed several important tests. As a result, he was suspended in the swimming team. To make matters worse, his girlfriend broke up with him. Edgar seems depressed all the time and doesn't care about anything anymore. When friends tries to talk to him, Edgar just says he just wants to get away from it all.
Edgar, okay na yun.
Doy?
Labahan niya, ikaw!
Kaya yun mo, kaya. One day, Edgar's friends found him.
Every 2 hours releases restraints and provides skincare, passive and active range of motion, ambulation, and toilet aid. Check restraints every 30 minutes. At least every 2 hours assesses circulation, skin integrity, and need for continuing restraint. Thank you.
Julia is 17 years old and has little empathy for the feelings and wishes of others. She has a great deal of charm that has the ability to manipulate others to get what her way. Julia was brought for evaluation because she had a history of persistently violating her parents' rules and was always having trouble in school. While in the facility, Julia was asking a nurse to let her use the cell phone. When unable to get what she wants, she started yelling, cursing, and became combative towards others.
Ma, anak ko, classmate may bago na iPhone 16. Dapat ini sa baka daw palitan.
Hindi na pero bakit makapalit mo man, dili pa nato kaya, mahalip ang vision niya.
Naong ka, love mo ako. Dapat palitan mo dahil ako yaon.
Dili sa hawdan niya on, pero kinahanglan ta ipunan niya kaya siya na amount.
Na dili na akong eskwela, dili ako pwede na may ako cellphone. Dapat may ako iPhone 16.
So the mother realized that her daughter was having a behavior that is unusual. So they decided to go to the ER for a follow-up checkup.
Umiban ako sa iyo sa ospital, ma. Palitan mo na ako ng cellphone. Ma, dili pwede. Di lang ko mo nga do, kung ako cellphone. Ano sa'yo, matapang na doktor? Magpalitan ako? Dok, anak ko, mama, gusto ko palitan ako ng cellphone. Ano, dili ko ni mo palitan, ma. Tapos, di dala pa jud ko ni mo din sa ospital.
Mukabito hindi mo sa iba ay yung mga pag-manifest ng mga simptomas na ano siya na
Kuan sa ligini siya, Dok, sa ES2, pimi siya niya mapatawag kay pimi mo bayad ng mga rules, mag-cellphone sa klase.
Ano po cellphone?
Pagdili mag-wild.
Ha?
matuman yung mga
Pagdili matuman mag-wild.
Ano ko cellphone, mama? Itapo ni mo din ito sa cellphone? Na! Nga dili man mo sugot? Nga dili man ka mo sugot, nurse? Ha? Imo din ang cellphone? Nga dili ko niyo tagaan cellphone! Kabalo ka ka na ang cellphone karon is importante sa akong school, sa akong study, sa akong mga classmates, tapos dili ko niyo tagaan ng cellphone? Unsa man ang ma? Unsa niyo? Ano gidala ko nimo dili Hay na ba? Mananara mo sa ako? Dili ko ninyo tagaan og cellphone? Ha?
pagkalma lang ka mo ihatag ka mo sa cellphone pero sa pagkakuman dili gayud na amo dili ka na anam ihatag mo ni mo gusto kay dili sa tanan higayon ang imo ang matuman.
As you've observed, the doctor is using the attitude of no demand and matter of fact, kay competitive na ang patient.
At the policy, ma'am, ang mukhang one daughter is combative and hard others. So, I have the consent imong permahan para ma-restrain ang mga patient, ma'am.
Ma'am, ang imo pasyente, ang imo anak, dili na nato ma-control, dili na nato ma-control. As a matter of fact, kuan na siya, mag-wild na siya, combative na siya kadayaw. So, ang ato yaw himuon, mas madayaw, na ato siya i-restrain, mga pagtubot na ato siya gapuson for a while. So, magkuha kami ng imong pagtubot, pinaali sa imong pagsuwat, sa imong kalan, sa pagperma nga ikaw, ihatag, o consent nga mo siya gapuson. Hantod na siya makalin.
Consent signed by the parent and the doctor's order. And now, there are 4 nurses using a 4-point restraint, using a square knot. One is in the upper head and the one is lower.
Ma'am Amy, pahalin mo yung pagkuha sa iyong vital signs.
And tie the 2 legs. So they're making sure that the patient is safe.
Ma'am, paglahatay ng tanggal.
The doctor is not only ordering a physical restraint but also a chemical restraint because she's ordering a midazolam IV. Okay.
Ma'am, ano yung pasyente ang muna yun, ang iyong sitwasyon. Pero abay lamang
They
dito, we are taking care of her.
For person to restrain
O
the
palihog
patient
ma'am, hindi
under.
nato siya
They will take
biyahan.
properly
Sa
sized
ay na
restraint
siya
for the
ginamos,
patient.
pahatod siya ng mukalma.
Pads, body prominences for applying restraint. Like what I said, safety is a must for the patient first. Then ties in knots so that the restraint can be released quickly in an emergency, like half ball or square knot only. of the tight knot if there's swelling or redness on it. Then adjust restraints, maintain good body alignment, comfort, and safety. Position patient legs by the eagle and one arm restraint. So you insert 2 finger para mas sure if di siya totally tied up kaya ang circulation. And then since the patient is 70 years old, so only 2 hours na. Unless my father ordered pa, another 2 hours for him. And then at least every 2 hours, release restraints like what I said earlier. For passive and active range of motion, ambulation, and toileting, we check ang diaper, puno na ba or kuan. For patient's comfort, and then check restraints every 30 minutes. At least every 2 hours, assess circulation, skin integrity, and need for continuing restraint. Since the patient is now calm and is now under control, 1 restraint at a time should be removed at 5 minutes intervals until the patient has only 2 restraints left. Both the remaining restraints should be removed at the same time. And then document the reason for restraints, the course of treatment, and the patient's response to the treatment while in restraints. I think that's all.
Hachiko! Hachiko! Susunod ako ibo. Hachiko!
At the ER, he claimed he is able to control other people's thoughts and actions. He said he can hear his ancestor's voice. While in ER, he became more and more responsive and combative. He points his sword to anyone because he perceives that everyone around him wants to take him down and kill him.
Oh, it's a mama, ani.
In this scenario,
Ano siya ni-restrain? Nurse, restrain sa nato siya, ha? Tapos ma'am, gamit man ang ay siya kung balik ma'am, tagaan na ba siya o tambal na para makarelax siya, ha? Tapos, ipapirma ko sa inyo mga mag-consent. Pero sa inyo, tiri lang sa tamang kay mag-assistant ako sa inyo, ha? Para pag-galing sa inyo pasyente.
check the doctor's order for restraint. Explain the reason for restraints and severe consent. Answer a claim for 5 or minimum of 1 person's restraint arrangement. Obtain properly sized restraint. Staff should be visible under ensuring that patient will ongoing restraints to alleviate fear, loss of control, and helplessness.
May nurse, pamatag ng nurse, o ano, minasulang nurse, 5 milligram, okay?
5 milligram, midasulong given.
Okay, thank you.
Pads bony prominences before applying restraint. Ties in knots so that the restraint can be released quickly in emergency. Adjust restraint to maintain good body alignment, comfort, and safety. Position patient with legs, spread an arm and one arm restrained to one side and the other arm restrained over the patient's head.
Sir, paki-check ako sa vital signs ng patient, ha? Kaya dahatag na ba kita ng tambal na paparelax. Ang heart rate, importante.
Assess the restraints are snug enough to prevent from slipping off but not tight enough to impair blood circulation. At least every 2 hours, releases restraints and provides skin care, passive and active range of motion and relation of pain. Check restraints every 30 minutes. Then after the patient is under control, 1 restraint at a time should be removed at 5 minutes interval. Okay.
Okay. Nurse, paki-check set ko sa diaper if nakaihi na ha para ma-monitor.
And then after, pagka-control ng patient, document the reason for and course of treatment and patient response to treatment.
The attitude use thank you, that's all our presentation.